So for the conflict of interest, I get research grants from VIF Healthcare through the institution. So adolescents living with HIV are underserved and vulnerable population, expected to experience greater challenges for long-term treatment adherence compared with adults. The two-drug regimen Dolutegravir Lamivudine is globally recommended for adults with HIV for the initial ART and also can be used for adolescent aged more than 12 years, weigh more than 40 kilograms in the European Union. So Dolutegravir Lamivudine has demonstrated robust and durable efficacy as initial ART in adult and data up to 144 weeks from the Gemini 1 and 2. However, we would like to show the data for adolescent, and the data for the 48 weeks result has been presented last year at the Adolescent HIV workshop. So the objective of the STAND study is aimed to provide additional data for using two-drug regimen of Dolutegravir Lamivudine as an initial ART for adolescent, that we can use pharmacokinetic exposure matching for extrapolation of efficacy in suppressed switch settings for adolescent weight more than 25 kilo. So what is the pharmacokinetic exposure matching for extrapolation of efficacy? The long definition, does it mean? So it's mean that in adolescent, if they have a similar pharmacokinetic exposure, we can have extrapolation and using data from adult data that have larger efficacy trials to lean on and be able to move forward to use this regimen in adolescent. So here we present the efficacy and safety data up to week 96. So the design of the DAN study is ongoing phase 3 single-arm multi-center open-label once daily fixed-dose combination of two drugs, the same dose as in adult, 50 milligram of Dolutegravir plus 300 milligram of Lamivudine in fixed-dose combination as initial treatment. The study was conducted in 3 countries, in Thailand, Kenya, and South Africa. The eligibility criteria including antiretroviral naive, age 12 to 18 years old, weight more than 25 kilograms, and the baseline viral load between 1,000 to less than 500,000 copies per ml, and no evidence of any pre-existing viral resistance. And what is the exclusion criteria? The main exclusion criteria is active hepatitis B or hepatitis C infection that need treatment, which we already learned from the case discussion yesterday that because hepatitis B need 2 drugs, so we cannot enroll at that time. And also if they have some hepatic impairment, we're not enrolled. So the data today, we will focus on week 96. Actually, the main study, week 144, it's about to finish data collection phase by the end of this year. So the methods, the primary analysis is primary endpoint assessment of proportion of participants that can achieve viral load suppression at week 48. So today's presentation is the secondary endpoints, whether it can sustain or maintain up to week 96. And the way of analysis, we use the snapshot analysis, intention to treat of exposure. However, because of one site has premature closure of the site because of the GCP non-compliance before week 96. So we also conduct sensitivity analysis to exclude data from that site to compare with as a sensitivity analysis population. So in terms of participants who meet confirmed virological withdrawal criteria, which defined as has repeat viral load more than 200 copies per ml, we'll have viral resistant testing to see whether they have any drug resistant issues. So the result, the study enrolled 32 participants with a median age of 17 years old, and there are 19 from Asian population and 13 from the African population. The median body weight is 53 kilograms, and about 1/3 had baseline viral load, which is considered as high, which is between 100,000 to 500,000 copies. And 83% was horizontal transmission. And in terms of the clade, they are between AE 59%, or all the Asian population is AE clade. or subtype, and then the African population have subtype A or subtype C. So up to week 96, there are 11 participants that had withdrawal from the study, and the reasons for withdrawal is from the adverse event, lack of efficacy for one case, and also for the protocol violation of pregnancy for one case, and another is more on the administrative issue on site closure or withdrawal consent. So therefore, in the sensitivity analysis, we will exclude 7 participants who are from the site that has premature site disclosure. So this is the most important slide, which is what is the percentage of proportion of the adolescent that can maintain viral suppression. So in the blue box is the intent to treat exposure population, which means include all 32 participants. So it's 69% had viral suppression at week 96. But in the red box is the sensitivity analysis that is 22 participants out of 25. So it's bring up the proportion to 88%. This is to show the dynamic of viral suppression at each time point. So by the week of 12 week after initiation, that is the highest proportion of achieving viral load less than 50 copies, which is 92%. And then quite maintained if you look at the red line, which is the sensitivity analysis. But in the blue line, you see the significant drop because of the site disclosure issue. And in terms of any cases who have virological withdrawal criteria, are there any resistant? There are one case that have confirmed virological withdrawal with low viremia, 3,752 copies. And then after repeat and try to amplify the drug resistant, while we're waiting for the result, the child maintain or have good adherence. So the viral load is resuppressed at week 84 and 96, and no drug resistance occur at that time. So in terms of change of baseline CD4, you can see that the CD4 is going up to around week 24 that have about 219 gain from the baseline and then stay high throughout the study. In terms of adverse events, overall, there are no new safety concerns relative to the data safety profile from using Dolutegravir and Lamivudine fixed dose combination in adult. So most of the reported adverse events is in the grade 1 or grade 2. There are only one participants that developed stage 3 HIV-associated condition, which is the pulmonary tuberculosis, which is not related to medications. And are there any serious adverse events? There are adverse events that was reported, 9%. However, that was not related to study drug. There are only one drug-related AEs that you can see in the table. There are one case who have decline in glomerular filtration rate, grade 3, and then discontinue medication. So what does it mean? How is benchmarking with the adult data? So in the graph on your left-hand side is the efficacy data. So in the DAN study, we show that 88%, if we use sensitivity analysis, have viral load less than 50 copies at week 96, which is similar to what reported in the literature from the pooled Gemini study in adults who are naive at the time of using Dolutegravir Lamivudine. In terms of the safety, on the right-hand side, you can see that overall, any adverse event is quite similar. There is a little bit of difference in terms of drug-related adverse events that is lower in DAN study, which is 3%, and 20% in Gemini study. And most of the report in the Gemini study is like nausea, vomiting, or headache or dizziness. And we think that this is because of this different population. It's not a direct comparison, but overall, we didn't see any safety concern comparing to adult data. And how about younger children? The younger children, they are ongoing Penta 21, which is a D3 study, that study on the using of 2-drug regimen of the Dolutegravir Lamivudine in children 2 to 15 years old. So we think that the 2-drug regimen would be an option in the future, and we need more data in children population. So in conclusion, what we learned from the DAN study is 2-drug of the Dolutegravir Lamivudine was well tolerated, demonstrated high efficacy, high genetic barrier to resistance in antiretroviral naive adolescent that can start directly with the 2-drug regimen. And the result in combination of well-established data that we can use pharmacokinetic comparison and then lend the data of efficacy support that Dolutegravir Lamivudine as a first-line ART option in adolescent, it can achieve and maintain virological suppression. Thank you for your attention.